This is the committee debates tax and spending cuts proposal. It's going to cut 13 or 14 million Medicaid recipients out of any help for Medicaid. And it's interesting because as I watched the Idaho in session, these same cuts were introduced, like the work requirement, in the Idaho legislature last year. And so when they're doing the budget in May, here we are in May and expected to be done in July, the prelude to that and the debate was work requirements. So watching this congressional debates and through C-SPAN, Idaho is kind of like the proving ground. Let's go ahead and test it out in Idaho. And that's why the legislative session is 94 days versus Utah, which is 45 days. So what the Idaho leaders are doing is they're doing the prelude to the debates in Congress. Like, for example, as I gave you, the work requirements to receive Medicaid. And listen to what the congressmen are saying. And these are from all over the country. I mean, this is not Idahoans. In fact, you won't see Simpson and Fulcher there because they voted for this turkey. Anyway, watch this, and I think you'll learn something.
This was just the beginning of the wave of Republican-led price hikes that continue to hit working families. Now the president wants to unilaterally repeal the Digital Equity Act, the clawback funding Congress appropriated to implement it. These programs were designed to help seniors, veterans, rural residents, and people with disabilities get the tools and training they need to get online. Republicans are also attempting to eliminate the requirement under the BEAD program that internet service providers offer affordable plans, despite the fact that these networks are built with taxpayer dollars. Just this month, Senate Republicans voted to permanently repeal an FCC program that would provide Wi-Fi hotspots to school children. We've seen what these choices lead to: kids doing homework in fast food parking lots or outside of libraries, like what we saw during the pandemic, and this is just quite simply unacceptable. We have made progress in closing the digital divide, but it's critical that we finish this job. Study after study confirms that cost is the biggest barrier to broadband access. Any serious solution we must tackle that head on. My amendment does just that. It delivers real relief to working families already struggling under President Trump's price hikes. I urge my colleagues to support this, and I yield back.
Thank you very much, Ms. Trahan. You're recognized.
Thank you, Madam. Is this on? Yes.
Madam Chair, I'm offering Amendment 307. Oh, got it. Thank you. Madam Chair, I'm offering Amendment 307 to safeguard access to IVF for millions of women who rely on it to start their families. And while I appreciate the opportunity to be here and to offer this amendment, as well as this committee's perseverance, there is nothing bipartisan or transparent about this process when so much of the debate over this bill happened in the middle of the night while most Americans were sleeping. It was a blatant attempt to prevent folks from tuning in, from hearing the contents of this disastrous bill, but people are watching. They're seeing what you're trying to do, and they're going to see how you vote on this amendment, which would simply require that the Secretary of Health and Human Services certifies that the GOP's reconciliation bill does not reduce or restrict state Medicaid programs from covering infertility treatment, because the ability to start a family should never be a privilege reserved only for the wealthy. Like so many couples across the country, my husband and I turned to IVF to have our girls. I know the pain of hearing that pregnancy might not happen. I know the silent heartbreak, the financial strain, and yes, the overwhelming joy when, thanks to modern medicine, I was finally able to hold my children in my arms. Every woman deserves that chance. President Trump recently called himself the father of IVF and claimed he wants to make it easier for women to have children. But actions speak louder than words. Just last month, this administration eliminated the CDC's reproductive technology surveillance and research team, the very experts who tracked IVF outcomes and access for over 30 years. Without that data, we're flying blind. And now, House Republicans are threatening deep cuts to Medicaid, the very program that could make IVF accessible to working families. Today, most Medicaid programs don't cover IVF. And for the majority of Americans without insurance coverage, IVF, which can cost upwards of $15,000 per cycle, is simply out of reach. If Republicans succeed in cutting Medicaid even further, that dream won't just remain out of reach, it will disappear completely. It will be women living paycheck to paycheck, women in rural areas, women of color, the very women already facing the steepest barriers to care, who will suffer the most. This amendment is about more than reproductive technology. It's about whether we believe that every woman, no matter her income, her zip code, or insurance status, deserves a fair shot at motherhood. Unfortunately, the consequences of this bill don't stop at IVF. Every one of us here has heard stories from our constituents, mothers, daughters, families, about how hard it is to access the care that they need. And yet, this bill, crafted behind closed doors by Republicans in this chamber and considered here in the dead of night, will only deepen that crisis. At a time when the United States ranks last in maternal mortality among industrialized nations, when hospitals are closing and care is harder to find, this bill pours gasoline on a fire that is already raging. Cutting Medicaid doesn't just mean cutting coverage. It means cutting off care to women when they are most vulnerable. In my district, those failures are real. In 2023, the only maternity ward in the western part of my district closed due to staffing shortages. Then the collapse of Steward Healthcare forced 2 more hospitals to shut down, including one that served as the primary provider for thousands of families. These aren't hypotheticals. These are closed doors, darkened hallways, delivery rooms that will never welcome a newborn again. According to the March of Dimes, 1 in 25 obstetric units has closed in just the last 2 years. Over 1,100 counties in America are now maternity care deserts with no hospital, no OB, no place to give birth safely. And now this bill proposes gutting the program that keeps what little is left afloat, Medicaid. If we do that, we won't just lose coverage, we'll lose hospitals, we'll lose doctors, and we'll lose lives. So to my colleagues, especially those who claim to support IVF, who care about mothers and family values, I just ask you to prove it. Support this amendment to protect IVF access. Reject the deep cuts to Medicaid in this bill to protect the hospitals, doctors, and services that make motherhood possible in the first place. Because if you are serious about being pro-family, pro-mother, and pro-life, then you must be serious about protecting Medicaid. And you must be honest about what's at stake. I urge my colleagues to vote yes on this amendment, and I yield back.
Thank you. Mr. Davis, you're recognized for 5 minutes.
Thank you, Madam Chairman, Ranking Member. The good book teaches us to care for the least among us. My 4 amendments do just that. For parents, child care is the work-related expense. My amendment would reimburse working parents up to $8,000 in child care costs. The meager current maximum of $1,200 was set at the turn of the century. Now the cost of center-based care for 2 children is more than the average rent in all 50 states. Yet the Republican bill fails to directly help struggling parents with the crushing burden of child care. Instead, the bill gives $731 million to businesses and ignores the tens of millions of working parents whose employers will never offer child care. And the small temporary $500 bump in the child tax credit excludes the poorest parents and is dwarfed by the $8,000 in relief offered by my amendment. If Republicans want parents to work, then please accept my amendment. The second amendment would provide life-changing help to hard-working, rent-burdened Americans earning up to $100,000. Rent unaffordability is at an all-time high, with about half of all renters being cost-burdened, especially extremely low-income households, seniors, and rural Americans. My amendment would create a new tax credit for low and middle income renters that would cover a percentage of the gap between 30% of their adjusted gross income and their actual rent. For renters earning less than $25,000, the credit would cover the entire 30% income to rent gap and then phase out. The Republican bill offers nothing to help struggling renters. Supporting my amendment would provide financial relief to thousands of individuals so that they can thrive without fear of eviction. My third amendment would provide a tax cut to tens of millions of low-income workers by enhancing the Earned Income Tax Credit. The EITC is a powerful tool to reduce poverty. Although the Republican bill gives an increased EITC for some Purple Heart recipients, it ignores the vast majority of individual workers. Workers aged 65 and older represent one of the fastest growing groups in our labor force. Millions of people, of workers, receiving and not receiving. We would also lower the eligibility age to 19 while enhancing the credit for all childless workers. Further, my amendment would include important flexibilities for foster and homeless workers, homeless youth. If the GOP bill can spend $211 billion on tax breaks for wealthy heirs, surely it can help vulnerable workers who are young, old, single, homeless, or foster youth. Finally, my fourth amendment would strike the permanent tax hike on foundations that would rip $15.8 billion in charitable aid from our communities, aid that supports food banks, houses of faith, veterans, disaster relief, rural health care, emergency assistance during economic downturns, and other critical needs. Policies that hurt foundations reduce grant making to charitable nonprofits across the country. Forefront, the Association of Grant Makers for the state of Illinois, estimates that the proposed tax increase on private foundations would result in $168 million less in grants made to Illinois nonprofits each year. Charitable giving represents the best in American generosity and the exact time when charitable giving and philanthropy are needed the most to offset the cuts in federal investment. Congress must strike this charity-reducing provision. Government should help people, not harm them. My amendments would help lift the burdens of tens of millions of families and workers, as well as promote charitable service. I thank you, Madam Chairman, and yield back.
Thank you, Mr. Davis. Mr. Norman, you have any questions? Mr. McGovern.
I just want to say to all of you, thank you for not giving in and for staying the course and fighting for your constituents, for the people of this country. Those of us on the Democratic side of the Rules Committee are grateful that you're here, and I know the American people are grateful that you are here. So, again, thanks so much. I yield back.
Thank you, Mr. McGovern. There being no, any of my colleagues, other colleagues, okay. Thank you all very much. You're now excused. Okay, yeah, I pronounced that one. Mr. Schweikert, Mr. Olszewski, Mr. Garcia, Ms. Sykes, Mr. Thompson, Ms. Simon, Mr. McGarvey, Ms. Gillen. And if you all would come down this way so we can spread out, if you don't mind. Would you mind moving that direction so people can get by?
We can
middle up here. Yeah, just go down, go down to the end, okay? It makes it a little bit easier to fill in. Get over that way. You're gonna be first, so it doesn't matter where you sit.
Just trying to get you all the way to the right.
Yeah, no, thank you. And the thing you're running in my life.
And that way you don't have room for your charts.
All right, so what's the chair for me?
There you go, there you go.
Can I sit in this chair, perhaps?
Do we have too many?
Is there not another chair?
Certainly, if you can get a chair in there. We got 9.
We can call this.
Mr. Johnson, you will be in the next group.
Not mine.
You're not in this group, Mr. Johnson. Okay? Okay, Mr. Schweikert, you're recognized for 5 minutes.
Thank you, Madam Chairwoman, and to members of the committee. I'm really impressed. I hope you're all very well caffeinated. Madam Chair, members, I'm actually trying to do something honest and unique here. The 2 pieces of legislation I have preliminary CBO scores that reach $2 trillion. $2 trillion in offsets and savings over the next 10 years. They're both morally, economically, quite rational. They do good things. The problem is they take on big concerns that often scare the crap out of all of us, but they're the right thing. So let's do the first one. I can do it fairly quickly. For anyone that's been here for a while, you've been tracking the MedPAC reports for the last half a decade, basically making it very clear that we have a major problem in Medicare Advantage and its offsets. As you saw last night, there was another scandal that broke in the media and potentially another set of indictments and criminal activities coming. So what happens when those of us who want the incentives of a system that manages care but benefits by helping our brothers and sisters, particularly in the seniors with their own benefits, be healthier, that the insurers who manage it make their profit by having the population be healthier and not by constantly scoring that population as sicker and as margins. And if, for those of you from the all the way back to the Obama years, let alone the Biden years, which that's what this one was written, they demonstrate that today Medicare Advantage is coming in at 120% of fee for service. The design was supposed to be at 95%. Just divide that by the money and then do it over the decade. That there is almost $1.5 trillion. We have introduced, there goes when it happens you use binders. Piece of legislation has already been introduced and we've turned it into an amendment for your consideration, Madam Chair, that would, over the decade, for a pilot program, but also become self-executing, realign the incentives in Medicare Advantage to actually fixate on helping populations be healthier than what is today scamming the system. There's about 20, 25 Democrats that a couple weeks ago wrote a letter basically demanding something similar to this model. There's those of us as Republicans have spent almost a year with healthcare economists. Speaker's credit, he let me hire a healthcare PhD for the Joint Economic Republicans. This isn't Republican or Democrat, it's good policy. And just that bill, our preliminary score is $1.84 trillion. If you want to do amazing things to help this country and do the right thing, there are these handful of policy opportunities that don't necessarily break down left and right. They're just great math, great delivery of services, and alignment of incentives. Madam Chair, the second bill is one that we worked on for about a year. Matter of fact, the young woman sitting in the back who abandoned me was actually the primary author of this, and it's a talent-based immigration bill. Within it, we added the president's golden visas, some other things. This one, our preliminary score is $174 billion over 10, but in the second decade, it makes amazing differences because we do something insane in this country. We educate populations and then we send them to their home countries to compete with us. Why would we do that? If we know we have, the models here are saying we're going to have these sorts of GDP growth. Almost none of my economists can hit that GDP number without a major change in our demographics. And that demographics is, how do you fight with the rest of the world who's trying to steal our smart people? We need to enter in the game. And it turns out a STEM-based, talent-based immigration system is one of the most elegant ways for productivity, for new inventions, and also for tax receipts and GDP growth. Both of these are written more by economists than politicians. We wanted to get the alignment of the actual math together instead of some of the, forgive me, insane things I've heard people say behind the microphones here today, where it's the political wedge for the next campaign. How about for once we get the alignment of the economics and the math and do good things? And those are my pitch. I yield back.
Thank you very much, Mr. Schweikert. Mr. Olszewski.
Thank you, Madam Chair. Thank you to the committee member, ranking member McGovern. I appreciate the opportunity. Before I begin, I wanted to just address a comment earlier from the gentleman and our colleague from South Carolina. To be clear, the government is not my God. Jesus is my God. So just want to be clear that Democrats, we actually have faith too, and I'm proud to sort of wear that and share that with all of you. I also deeply believe in the value of work. And so you and hopefully your colleagues will love my amendment today, because it's an indisputable fact. The more people that have access to health care, the better it is for everyone. It's better for families, it's better for communities, it's better for businesses. There are a lot of reasons to vote against the reconciliation bill before you. It adds trillions to the federal deficit to fund tax breaks for Americans who need them least. It does nothing for working class Americans to lower costs in any real way. It will increase healthcare costs for millions of Americans, for those lucky enough to still have healthcare coverage. The bill proposes sweeping changes to Medicaid to help offset these tax breaks for wealthy individuals and large corporations. One such change is new work requirements that would result in millions of Americans losing their health coverage entirely. Hundreds of millions of Americans are set to hundreds of Americans will literally lose their lives, according to the Center for American Progress. These changes won't even achieve the savings that we believe our Republican colleagues think they will. That's because nearly everyone with Medicaid coverage who's able to work already is. 92% of adult Medicaid enrollees are either already working, in school, or serving as a caretaker, or unable to work due to illness or disability. Most are working low-wage, hourly, or seasonal jobs in vital industries, including healthcare, manufacturing, or agriculture that don't offer employer-sponsored healthcare. So it was no surprise that when states began implementing work requirements, employment did not go up. Instead, the arduous paperwork meant that even more who were working or should have been exempt lost their coverage anyways. These are not people who are gaming the system. These are honest, hardworking people just trying to get by. But if our Republican colleagues insist on implementing new work requirements, we should also insist that work is actually available. Anyone who needs a job to satisfy these misguided work requirements should be able to find one. So I want to connect Americans to work. I know that you all do too. For that reason, I'm introducing Amendment 151. My amendment requires the Secretary of Labor to establish a national employment placement program that provides a broad range of public and private employment opportunities. And under the amendment, anyone seeking employment within the job program will be exempt from Medicaid work requirements. Americans who are seeking work in good faith will keep their health care coverage. The amendment empowers the Secretary to create the program and its operation, to define acting in good faith, to determine the scope of the placement program, and all other relevant details. The amendment is reasonable. It simply says, before you take health care away from able-bodied constituents, let's make sure they actually have access to a job. Madam Chair, I've been here since early this morning, and I want to commend you for the respect and the decorum that you are keeping in this meeting, and I mean that sincerely. So thank you for the ways in which you're conducting this meeting. I also heard you mention, though, that you want to operate in a bipartisan fashion. bipartisanship requires consensus and agreement. So, in that spirit, I will say that I offer one of over 500 amendments that this committee can adopt, can take up. I challenge the committee to consider a dozen or two really good ideas that have been presented to at least truly move forward in that spirit of bipartisanship. And with that, I thank you for the opportunity, and I yield back.
We did have bipartisan votes in the committee, so maybe you'd like to vote for the bill and make it bipartisan. Thank you. Let me see, Mr. Garcia.
Madam Chair, thank you for this opportunity. I'm here to discuss the amendments that I submitted, numbers 112 and 420. Amendment 112 eliminates a provision that cancels unobligated funding from the Neighborhood Access and Equity Program. This amendment is not explicitly about the devastating Medicaid cuts that the majority is trying to move forward, kicking millions of Americans off their health care, nor is it about the billions of dollars in cuts to food assistance that families rely on to put food on the table. This amendment is about the way people move from point A to point B safely. It's about the glue that enables people in urban and rural districts alike to actually get their health care appointments or go to the store for groceries. And if the majority is set on imposing strict work requirements as a condition for receiving Medicaid and SNAP benefits, they should be supporting my amendment. Why? Because the NAE program helps people get to and from their jobs. NAE was created to support infrastructure projects that increase safety and transportation access. That transportation access is the lifeline that allows a grandmother who depends on a bus to get to her doctor's appointment. And that safety focus creates a complete streets approach that protects kids when they walk to school and cyclists when they commute to work. In fact, a city represented by one of my Republican colleagues in this room received NAE funding to build a pedestrian bridge over railroad tracks, accomplishing two goals. One, connecting two communities that were separated by said railroad tracks, and two, protecting pedestrians and cyclists moving between communities. The bill before you places billions of dollars for safety projects at risk nationwide. We should not be putting the safety of our constituents at risk to pay for tax cuts for the wealthy. And if you all really want people to fulfill work requirements as a condition for Medicaid and SNAP, the very least that you can do is ensure that people get to their jobs safely. I urge you to support Amendment 112. Next, I'd like to discuss Amendment 420. This amendment ensures that revenues from new registration fees on electric or hybrid vehicles are also spent on public transit. Since 1982, Congress has ensured that revenue increases for the Highway Trust Fund cover authorizations under the Mass Transit account in addition to the highway account. As written, all of the revenue will be deposited in the highway account, meaning transit will see its small share of the total further reduced. This moves us in the opposite direction of where we need to go. You all may think that this is only a big city problem, but maybe big city problems aren't your top concern. But defunding public transit is just as much a problem for rural America. In April, the Transportation Committee heard from the executive director of the Prairie Hill, South Dakota Transit Agency, not a big city. She testified that America's rural population is declining, but rural transit ridership increased 15.6% in 2007 to 2019. And who are the people relying on rural transit? Senior citizens who take their local bus to get to the grocery store. disabled veterans trying to get to the VA, and patients who rely on non-emergency medical transportation to get to their dialysis appointments. Amendment 420 simply directs the vehicle registration fees in the reconciliation bill to cover authorizations from both the highway account and mass transit account. I urge your support on Amendment 420. Thank you, Madam Chair, and thank you to the members of the committee for allowing me to testify.
Thank you, Mr. Garcia. Ms. Sykes, you're recognized for 5 minutes.
Thank you, Chairwoman Fox, to the ranking member, and to all the members of this committee. Thank you for allowing me to come and testify before you today. This is my first time in the Rules Committee, and hopefully next time it won't be as long of a committee, but you all are lovely, and it's been a pleasure getting to know you, and hope I can acquaint myself with you further. I am honored and proud to represent Ohio's 13th Congressional District, and we're in Northeast Ohio. And I often call my district the birthplace of champions. We work hard, we're kind, we're creative. We have the Midwestern grit that people are so jealous of all over the country. And the people who I represent are worthy of my being up almost all the night in the morning to advocate on their behalf. The people in Ohio's 13th Congressional District are looking for opportunity. And that's exactly why I came to Congress. They want the opportunity to live. In Ohio, we have some of the highest infant mortality in the entire country. In Ohio, we have some of the highest maternal mortality in the entire country. And for Black women and for Black babies, deaths are even higher than their white counterparts. We were proud to expand Medicaid in the state of Ohio to make sure that we had healthy moms, because if you have healthy moms, you'll have healthy babies. But this current reconciliation bill will put that in jeopardy and make us lose all of the gains that we have, saving the lives of these gorgeous, beautiful infants and their mothers. We also, like many other parts of this country, have an issue with substance abuse and mental health treatment. And because of the Medicaid expansion and Medicaid itself, people are able to get the treatment that they need and want. People want to live, and I want to make sure we're giving them the opportunity. Furthermore, Madam Chair, our seniors rely on Medicaid, many of them as their primary way in which they get their long-term care. I don't think most people thought going into this election that the mandate was that their grandmothers would be kicked out of the nursing home. And so I am very concerned for this reconciliation bill, especially as if it were to pass. And unfortunately, as this bill continues to take access to care for my constituents, to counter this, I'm offering an amendment to strike the entire section addressing Medicaid from this bill that protects more than 201,000 people, including more than 83,000 children and nearly 18,000 seniors who would risk losing coverage in my district. Madam Chair, I heard one of the members of this panel, one of the Republican members, say that if you have your health, you're pretty rich. Unfortunately, this bill will bankrupt people all over the country in more ways than one. And I also heard some Republican members on this committee talk about the value of work. Well, here's an interesting fact for all of you. The number one employer in Ohio's 13th Congressional District, our number one employers are healthcare systems. And I can guarantee you, if this bill were to go forward, you would be putting people out of work. Let me say that again. You would be putting people out of work in Ohio's 13th Congressional District. The nearly 30,000 people who work for our hospital systems, who rely upon the Medicaid program to reimburse hospitals for care, will be jeopardized. Their jobs and their livelihoods would be jeopardized. So not only is this a matter of decreased care in my community, you are going to put people out on the streets, impoverish them, and decimate our local community. That is the reason why I was willing to be up all night and stay here for hours to testify on my community, because we cannot afford this bill. Additionally, as it stands, this bill moves to defund Planned Parenthood, wiping out access to reproductive health care for at least 20,000 Ohioans. With one of my amendments, because I have 8 of them, this section of the bill would be removed, ensuring that Planned Parenthood can continue to provide healthcare access across the United States, including the clinic that is in my district in Akron, Ohio, which, by the way, is the most active clinic in the entire state of Ohio. This reconciliation bill as it stands does not improve the lives of people of Ohio's 13th district or really anywhere in this country. And if the committee were to adopt my amendments, constituents in all of our districts would have more money in their pockets, greater access to health care, and more food on their tables. My third amendment is the Lower Your Taxes Act, which is a bill that I introduced early this year and 2 years ago, and it would love it to be included in the reconciliation bill. This amendment would help families across the nation by making corporations pay their fair share and expanding the earned income tax credit and the child tax credit. Additionally, I am offering an amendment to include the earned income tax credit look back, which would allow all taxpayers to use their earned income from previous years for calculating the EITC. People have told us they cannot afford living in the United States and putting more money in people's pockets in order for them to pay for gas and groceries and housing and healthcare. Madam Chair, I see that my time is coming to an end and I want to continue to be respectful of your committee, so I won't offer the other two. But thank you for giving me the opportunity to speak before this committee and advocate on behalf of my hometown. Thank you, Madam Chair, and I yield back.
You may submit your statement for the record. Thank you very much. Mr. Thompson, you're recognized for 5 minutes.
Thank you, Madam Chair, and all the members, Ranking Member McGovern, for being here all day, all night, all morning. And thanks to all of my colleagues who came to testify to ensure that our constituents would have an opportunity to have a little daylight shine on the debate regarding this terrible bill. A bill that adds to our national debt somewhere between $3.4 and $4.3 trillion, and that doesn't include the interest on that debt. Takes health care away from 13.7 million people, and it doesn't make them immune to being ill or injured, it just makes them uninsured. So this is going to add extra cost in the way of uncompensated care to our hospitals. 9 million people will lose food security, and all of this is to give a big tax cut to people who really don't need one in this environment. Madam Chair, I have a couple of amendments. My first amendment would strike the energy provision and restore the green energy tax credits. The American energy resurgence is at a crossroad, and my Republican colleagues seem eager to take the country down the wrong path. This reckless bill would gut America's clean energy production, raising the energy costs for millions of families and killing hundreds of thousands of good-paying manufacturing jobs. Repealing these clean energy credits would raise electric costs by more than $110 per year per household. That's to all of our constituents in red states and blue states. And despite what my Republican colleagues say, clean energy is the industry of the future. 93% of all new American energy supplied last year came from solar, wind, and battery storage. When we passed the clean energy credit, we deliberately paired supply and demand side incentives. By repealing some of these credits, you put at risk the entire supply chain at a time when the need for energy has never been greater. And just as energy demands dramatically increase with AI and crypto, my colleagues on the other side of the aisle are looking to decrease our nation's ability to meet this demand. Repealing these credits also cause economic pain to all American families. Whether my colleagues believe it or not, clean energy is the industry of the future, especially in Republican states and districts. Over 400,000 new clean energy jobs have been created since 2022. More than half are located in Republican districts. And this also disadvantages us at a time when China is trying to dominate the global clean energy supply chain. Shutting off the most impactful tool we have to combat this is absolutely reckless. I would urge all of my colleagues to support this. My second amendment deals with would strike the provision that the Republicans stuck in this bill to eliminate the $200 tax on silencers. At a time when Republicans are taking health care away from 3.7 million Americans, food assistance away from 9 million Americans, and child tax credits away from 4.5 million children, it's outrageous that they would spend $1.4 billion to make silencers cheaper. I'm disgusted that the congressional Republicans are spending $1.4 billion to make it harder for victims of mass shooters to know where their shots are coming from when they're trying to run for cover. And it's appalling that their actions will make it more dangerous for law enforcement when they respond to these mass shooters. Madam Chair, silencers kill cops and make it easier for criminals to evade capture, but they do nothing to muffle the devastation that family members feel when they lose a loved one. As a combat veteran, a lifelong hunter and gun owner, I can tell you this provision has nothing at all to do with hearing protection, but it has everything to do with making money for a certain segment of the gun industry. If you're concerned about protecting hearing from gunfire, buy and use earplugs. I urge members to support these two amendments, and this one in particular to restore the tax on silencers and to promote public safety. And I'd like to submit for the record, Madam Chair, a list of data showing where silencers were used in mass shootings to kill cops, to kill kids, to make it more difficult for police to respond and to make our communities less safe.
Thank you, Mr. Thompson. Without objection.
Thank you.
That will be done. Ms. Simon, you're recognized for 5 minutes.
Thank you, ma'am. I really do appreciate the opportunity to speak to you all today. And what a day it's been, Madam Chair and Ranking Member. Allowing me to speak on behalf of my constituents is one of the great honors of my life as a new member of the United States Congress, so thank you. And as you've heard from my Democratic colleagues today, the consequences, the deep, profound consequences of this bill and what the real life consequences will have on families in my district and across this great nation are devastating. My amendments are about 1, protecting access to reproductive health care, and 2, protecting our social safety net and our federal workforce. 1, my amendment focusing on repro health. We all know that Medicaid ensures that millions of Americans, millions of working poor and low-income Americans have access to essential reproductive health care, including birth control, including prenatal care, including postpartum. My amendment would prohibit cuts to reproductive health services, including counseling, birth control, prenatal care, pregnancy, and of course, again, postpartum care. It would do so by requiring that the actuary of CMS certify that the majority's bill would not decrease access to or coverage to any of those things. Mercy. Don't touch women's reproductive health care. But there's no question in any of our minds on both sides of the aisle that this bill would do exactly that, attacking women. When we talk about the majorities pushing through the largest cuts to Medicaid in United States history, here's what it really means. It means Medicaid now covering 40% of all births in this great nation, including prenatal, including pregnancy care and postpartum. It means that millions of people in California, my district, and across this country will lose access to contraception, to family planning, and cervical cancer screenings. My God. Cutting Medicaid would mean rolling back progress. The Second Amendment that I presented and that was voted down shamefully by my Republican colleagues in the Oversight Committee, it was an amendment that would protect access to SNAP and support federal employee benefits. Simply put, this Second Amendment says that 1, if the Trump administration cuts SNAP, the budget by even $1, that the provisions in this bill that would cut federal employees' salaries, their pensions, labor protections would immediately expire. I know my time is about to expire, but I want to say one thing. Being a new member of Congress, what has hurt me the most as a woman who was a teen mom, who took my daughter on the bus every single day to childcare, and I got support. I then, as a transit-dependent person, once a month took an hour-and-a-half bus to get $26 worth of food stamps, then would go to college, and then my day job, and then pick that baby up and come back again. That baby is an attorney. She passed the bar on the first time. How dare we cut benefits of hard-working Americans? I gotta tell you the second thing that's really deeply on my heart. I learned that the child care workers in this here building who take care of the children of members of Congress make $30,000. You think they can pay for a 2-bedroom in Washington, D.C.? If you haven't been poor, don't legislate for the poor. Let's step up and protect Americans who are working with their full bodies, their full spirits. Instead, you are putting forth a bill that pathologizes the folks who need us most. Lastly, Madam Chair, I asked every Republican in the conference to walk with me after you vote this weekend. Get on a plane, come to the Children's Hospital in Oakland, and you tell the BMT nurses, you tell that mother who has a child with TMP in her nose, that that child may in fact die. Come with me and walk with me and stand in line like I did when my husband died at the Social Security office begging for a $600 death benefit. Walk with me. You all have an opportunity to vote your conscience, your spirit. Vote for the people. Vote for the real people of this country that keep the tapestry moving, and I'll yield back.
Thank you, Ms. Simon.
Thank you, ma'am.
Mr. McGarvey, you're recognized for 5 minutes.
Thank you, Madam Chair and Ranking Member. The Congressional Budget Office and every single credible expert who has looked at this proposal says that this bill cuts Medicaid. It takes health insurance away from millions of Americans. But despite that, Republicans insist that this doesn't cut Medicaid. Okay, fine. Great. If that's the case, then my amendment should be the least controversial and most bipartisan thing we've heard today. This amendment, Amendment 224, merely states that every child and disabled veteran who gets their health care through Medicaid gets to keep it. The bill doesn't go forward unless children and disabled veterans are guaranteed to keep their health care. And this is incredibly important, because 40% of Medicaid recipients nationwide are children. In my state of Kentucky, it's over 40% of our kids rely on Medicaid for their health care. Veterans, 10% of our veterans use Medicaid to get health care. So for our children who need us, for our disabled veterans who have served us, let's protect their health care. The numbers don't lie about how important it is, but the numbers don't tell a story. I had a Medicaid roundtable in my hometown of Louisville, Kentucky. And June, her mom, Meg, showed up. June's a little girl. She has quadriplegic cerebral palsy. She relies on PT, OT, speech therapists, so she can stay at home with her 2 brothers, her dogs, Vinny and Pepper, and her mom, who's the only caretaker who can make her smile. She can't be at home getting the care and the love she needs without Medicaid. Do her parents work? Of course they do. Her mom works multiple jobs. But a couple of weeks ago, June had 3 spine surgeries in a week. Medicaid paid for that. No family can cover these types of costs. And June wouldn't have them if it weren't for Medicaid and the Medicaid waiver she's on. Madam Chairwoman, we simply cannot deprive June or any other child or any other family in this country of the health care that they need. This should not be controversial. It should be guaranteed. And my amendment does that. And the only way this bill should go forward is if we know that our kids will not lose their health care. Thank you, and I yield back.
Thank you, Mr. McGarvey. Ms. Gillen, you're recognized for 5 minutes.
Well, good afternoon, everyone. It's a pleasure to be before the Rules Committee again. Thank you, Madam Chair. Thank you, Ranking Member McGovern. I'm testifying today to speak in support of my amendment number 2, which will eliminate the SALT cap and restore the full state and local tax deduction to cut taxes for my constituents and millions of American families who are being hurt by this unfair cap. My amendment will deliver on the promise that President Trump made when he campaigned in my district on Long Island and said he would get SALT back. Madam Chair, state and local taxes were made deductible from federal income tax in 1913 based on the fundamental principle that Americans should not be double taxed on the same income. Double taxing Americans is simply unfair, and this principle held firm for over 100 years. My constituents pay some of the highest taxes in the country and send far more to Washington than we get back. Many of them are facing a cost of living crisis right now, and they're counting on all of us to lower their taxes and bring their costs down. I came to Congress to try to make their life more affordable. However, despite 100 years of precedent, for the past 8 years, Long Islanders have been crushed by double taxation of the SALT cap. Right now, Congress has the opportunity to correct this wrong and ease my constituents' burden by eliminating the SALT cap that's making it so hard for families and small businesses in my district get by. This is about fundamental fairness for high-cost states like New York, which again, give more to Washington than we get back. And let's just put an end to the inaccurate proposition that reinstating this full deduction of SALT is red states subsidizing New York, California, and other high tax states. That is false. And in fact, the exact opposite is true. For every $1 that New Yorkers send to the federal government, we only get around 86 cents back on average, while the majority of other states get more back than they send to Washington. In 2017, the year that the SALT cap was instituted, New York sent $35.6 billion more to the federal government in taxes than it received back in federal spending. Restoring SALT helps adjust this imbalance and make sure that hardworking Americans on Long Island, in New York, and in other high-cost states are treated fairly. Long Island is one of the most expensive places to raise a family in the United States. Having a cap on the SALT deduction has hit everyone's pocketbooks. The president has talked about red versus blue, but I assure you this double taxation hurts Republicans and Democrats alike in my district. It hurts union members, it hurts teachers, it hurts firefighters, and it hurts police officers. I've heard from countless hardworking families and small business leaders in my district who've had to pay tens of thousands of dollars more in taxes, making their lives even more expensive. And Madam Chair, by way of example, I'd like to offer a letter into the record that was sent by a delegation to every member of the Long Island delegation from business leaders and economic development leaders in the district asking us to reinstate the full SALT deduction.
Without objection.
Since taking office, I have been fighting to fully restore this deduction by writing to leadership in the Senate and in the House, by testifying before the Ways and Means Committee. I joined the bipartisan SALT caucus. I even volunteered to go to Mar-a-Lago to talk to the president about how important it is for my constituents to get the full deduction back. And that is why I'm proud to lead this amendment to lower taxes for Long Islanders and others who are harmed by the SALT cap. My amendment has been co-sponsored by 16 of my colleagues from across the country, and today I ask the members of this committee to make my amendment in order and bring an up or down vote on eliminating the SALT cap and cutting taxes for Long Islanders and millions of other hardworking Americans to the floor. Thank you, and I yield back.
Thank you very much. Mr. Norton, any questions?
Congresswoman, thank you for your testimony. Now, to eliminate the SALT cap, you're talking about it's 10,000 now, take it off completely?
That is what my amendment does. It strikes the cap altogether.
How is that not a tax break for the rich?
Congressman, in Long
Just real
Island,
quick, I got 5 minutes, just real quick. It's an easy answer.
in my district, this cap impacts middle and working class
I
families.
get that, but if you own 5, let's say, and I'm a real estate developer, if you have 5 houses, should I be able to deduct the local and state property tax on 5 houses?
You should be able to deduct it for all the houses that you own.
Okay? Okay. Mr. McGarvey, now you said Medicaid for everybody ought to be guaranteed. Did I understand you right?
My amendment is for children and disabled veterans only, Mr. Norman.
Oh, just for disabled veterans?
And
Okay.
children. Children and disabled veterans who are already on Medicaid should be able to keep their Medicaid. It's a guarantee that this plan doesn't keep
Now,
kicking off.
you would make sure that it's not done fraudulently, that something wasn't, there's a lot of fraud and abuse in the Medicaid system. Your President Biden admitted that. Was that not, I mean, if it's fraudulent, regardless of who it's for, are you for rooting that out?
I think we should get rid of all waste, fraud, and abuse. My question to you is, are you in favor of kicking kids off their health care? That's all this amendment does, is prevent kids from getting kicked off their health care. If you are not in favor of this, you're in favor of kids losing their health care.
It's gotta be fraud, you gotta get the waste, fraud, and abuse out, I think.
How many kids like June who have quadriplegic cerebral
it's
palsy
real. No,
are
that's
fraudulently
the very
using Medicaid? We're
picture-
talking about children and disabled
The very
veterans.
picture you showed is the kind that you want to be held. Congressman, did I understand you believe in the work requirements?
I disagree with the work requirements. I'm simply saying, Congressman, if we're going to have them, we should make sure there are actually jobs available.
Okay.
And if people are seeking them in good faith, they should be able to keep their health care.
And who should judge whether a job is available?
My amendment fully authorizes the secretary. It's very flexible. It allows the secretary to promulgate all the regulations around this program to define good faith. But I think we should agree that if we're going to require a work requirement for health coverage, that we should at least make sure we're encouraging people to actually seek that work.
How would that actually, the secretary's got a lot of, I assume you're talking about Secretary of State, or what secretary?
Secretary of Health.
Secretary of Health. How, would he have time to?
Secretary of State definitely does not have time. He has too many jobs as it is, Congressman.
Secretary of Health, how would he have time to go out and see it, determine if there's work available? How many people, where do you live?
I live in the Baltimore suburbs.
Okay. How do you logistically put that pressure on the Secretary of Health to find work, see if work is available? Walk me through real quickly how you do that.
Well, first of all, I would restore all the firing that the secretary did, so he actually has the staff to implement the program. But following that, this is what I said in testimony. We know that we actually have not seen the savings in states that have implemented these work requirements. But if we're going to, let's provide the secretary with the supports and allow, again, this is why the amendment's flexible, allows the secretary to define what that job placement program looks like and what acting in good faith looks like.
What if it doesn't fit what the particular person wants? How does that work?
That's why it's up to the secretary. It gives full discretion to the secretary to define what acting in good faith looks like. So if the secretary says you need to be looking for a job, you are not acting in good faith, that person would then not be eligible for health coverage because the program would define that. So yeah.
Well, I can see you believe that, but now we've all been up for kind of a long time. It would take a Secretary of Health living, not sleeping at all to try to handle all that. If he has to be the arbiter of finding whether you've got a job available,
With
that
all
would be hard, I would think.
Sure, but then with all due respect, just imagine how hard it's going to be to prove that people aren't seeking work. You have the same problem by putting this requirement in the bill.
What they do is,
how is the secretary going to do that with this requirement, without the staff, et cetera? I mean, they're the same logistical challenges of actually requiring proof of work.
Yeah. What you normally do is you have them go in, sign a piece of paper that you interviewed at a particular job, and the employer has to sign it. So that's the only way. I don't know how one man would be able to do that.
Well, then if they're going to do that, you got the foundation for a job program that allows people to be connected to those job opportunities.
And ma'am, thank you. This is your first time. Welcome here.
Thank you.
You did a good job on presenting your amendment.
I've done it before. Thank you, sir.
Y'all, I'll just tell you, I think sleep is overrated. Mike, we don't need sleep. We can do this. Thank all of you for coming. Hey, y'all back.
Thank you, Ray. Mr. McGovern.
You know, I think one of the problems in this Congress is that there is a disconnect, I think, between a lot of people who serve here, who live pretty privileged lives, and the reality of millions of people in this country who are struggling to get by. I mean, the idea that somehow people just want to be poor, that people want to be on SNAP, that people, you know, want to be on Medicaid, that that's their life goal, it's just so absurd. It's beyond words. And I support making all of your amendments in order. I'm not sure I support all of Mr. Schweikert's ideas, but I know
you eventually love them.
I know he's a thoughtful member, and he should be able to make his case on the floor. You know, I am somebody who has been advocating that our healthcare system be more oriented toward keeping people healthy. And I authored legislation that produced the second ever White House Conference on Hunger, Nutrition, and Health that we did during the Biden administration. And you might want to read that report. I mean, it has a plan to eliminate hunger, but also has a plan on how to change our healthcare system, focus more on keeping people healthy as a way, you know, not only for good healthcare, but for controlling costs. And I think we had to figure out a way, maybe that's a bipartisan area where we can work together. But it's precisely one of the reasons why you have been hearing me scream about not cutting programs like SNAP. Because if you want people to make healthy choices, they have to be able to afford to make those choices when they go to a grocery store, or sometimes don't even have access to a grocery store, right? I mean, and the average benefit is about $2 per person per meal. I mean, you can't even buy a cup of coffee in the Capitol complex for that. So, I mean, so let's not undercut programs that give people the ability. In the case of SNAP, they have the Double Up Bucks program, which enables people to buy, fresh produce from local farmers in their areas, and they get double the value if they make those healthy choices. I think all of that is good, because if not, if we start to continue to erode these programs, the cost is going to be incredible. You know, hungry kids don't learn in school. There's a cost of that. Senior citizens who take their medication on an empty stomach, when they're told to take it with a meal, they end up in an emergency room. People develop chronic illnesses that last a lifetime. So, you know, I'd love to talk to you about that. You also said that all your ideas came from economists, not politicians, but correct me if I'm wrong. I think the golden visa idea came from a politician, Donald Trump.
Mr. Ranking Member, we wove that in as a sweetener, but we actually did a modeling with a couple of economists that the total number was like 800 a year. So,
yeah, and I have another question, which is just pretty straightforward, and I hope you can answer yes or no. I mean, do you support adding trillions of dollars to the national debt, as this bill does? And I know it does.
Mr. Ranking Member, that's actually why I just gave you a solution to that.
That's why you give me what? Just give you a solution. Right, I know, but yeah, I know, but I mean, I'm assuming that you may not have, your solution may not make it to the House floor. Well, I'm not the chair of the Rules Committee. But I mean, it's a serious question. I mean, there's no doubt that this bill as written adds trillions of dollars to the debt, and so so all the deficit hawks out there who say that they want to do something about the debt and then just kind of go along to get along, I don't really think that helps very much. But I mean, and Ms. Simon, I whatever you're taking and drinking, I want to do that too. I want some passion. I'm out of steam, and but I appreciate everybody's passion here.
Sir, can I say one thing?
And I want to say this at every panel. Thank you for being here, for presenting your ideas. I think it means a lot to people who are observing this process, and I think it's reassuring to the American people that, you know, people get it and people are fighting for them. So I yield back.
Thank you.
Oh, hold on. What am I doing? What am I?
Just very briefly, with all the love and all the respect, why I did call folks in. I ran an organization, the Young Women's Freedom Center, for over a decade. I got my MacArthur Genius Fellowship for doing that work, because what we found and what we knew, Young parents don't want to be poor. They want good work. Work requirements require something on the other side. An employer who wants to give the job and provide a prevailing wage and provide the health care and the skill building and the opportunity. You don't put wealth development on the poor. And so I would love to work with you and every member of this committee moving forward, of running organizations, running reentry programs, creating jobs, lifting folks out of poverty. We can't legislate from ideology. We need practitioners to tell folks how to do it. That is how we create real sustainable opportunities for folks to get out of poverty.
And I'll just say one last thing. I mean, I don't know when it became okay to stigmatize people who are struggling in poverty, to kind of generalize in a way that they all fit into this category, that none of them want to work. That's just not true. That's just not accurate in any way, shape, or form. And maybe, you know, if some of the committees of jurisdiction that came up with some of these ideas to go after programs like SNAP and Medicaid or whatever, and maybe they actually talk to real people. You know, I mean, not, you know, individuals from some right-wing think tank, but real people. I mean, we might have a different outcome. Thank you.
Thank you, Mr. McGovern. Ms. Scanlon, you're recognized.
Thank you, and I just want to reiterate the ranking member's thanks to everyone who's been here for so many hours with us. We really do appreciate it, and particularly I appreciate the emphasis in the amendments on controlling costs for people and recognizing what costs do to families, because we did last night after 5 o'clock, we got this letter from the CBO in which they estimated household resources and what would happen to household resources based on this bill. And what they found was that household resources would decrease for folks who are in the lowest tenth of income distribution, and they would increase for those in the highest tenth, because they're looking at both the tax cuts that are included in this bill and the cuts to benefits that families, particularly lower income families, rely upon. So there's a lovely graph that shows just how those cuts are going to impact household income if this bill were to become law. So thank you for your amendments to try to ameliorate some of the impact there, and I yield back.
Thank you, Ms. Scanlon. Mr. Scott, you have no questions. Mr. Goose.
I thank the chairwoman and thank all the witnesses for their testimony and their thoughtful presentations to this committee. Without belaboring the point, as I proceed to belabor the point, I want to ask my friend from Arizona a question. I don't know that there's a member of the House who has spent more time on the House floor bemoaning the deficit and our national debt than you, Mr. Schweikert. And I know that you have a special order hour every week. I've watched it from time to time. I may be one.
So you're the one.
I may be one of you. You're the one who's watched it.
Hey.
Waiting for a moment like this one where I could finally pose this question to you, which is, I have to imagine that this is a painful exercise for you in light of the Committee for Responsible Federal Budget's real condemnation of this bill in terms of what it would do to the deficit.
And to my friend, you know, you're one of the people I actually think very fondly of, because you've asked some brilliant questions over the last couple of years when I've done floor speeches and how things work. But what I found around here is we do lots of complaining and very little intellectual capital. And so I started almost a year ago on part of this project. And the idea is, I just showed up in front of you with slightly over $2 trillion in savings, offsets, however you want it, and they're not particularly partisan. They're actually great economics and alignment of incentives. So, you know, besides
just to be clear, I mean, the ranking member, I don't want to speak for him, I think he indicated that we would be happy to consider that amendment, and yeah. It's the chairwoman that you have to convince, not us. It's the closed rules.
Look, part of my battle is, and many of us are, when you end up in the majority or vice versa, you go through this, is the body doesn't really like complexity anymore, or maybe it ever did. And we have really complex problems. Understand, the movement in interest rates today, if you look at them, just even over since we get here now, it's $2 trillion over the 10.
Yeah.
Just the movement in interest rates that we've seen recently. It's the debt we're talking about here. And I don't think we understand how to, so.
You're making a real compelling argument against this bill.
No, actually, I agree with you. Actually, you have the flip side. If we don't do some of the extensions and particularly the accelerated depreciations for research and development, those things, we can't, we have a demographic crisis.
Why not just do those?
Actually, tax cuts for individuals.
I mean, this is what the Committee for Responsible Federal Budget has said, right? They've essentially said.
But even that there's three. That's about another $600 billion. So even that's $3.6 trillion. Just those two things in cost. You still have to find offsets, even with those. My argument to you is, Madam Chair and members, and maybe even some members on my side, give this fair read, because it would be the one moment we could also communicate to those bond markets that are functioning now running our country that we're doing something to offset policy. If I can't change the policy, maybe I can find a way to pay for it.
I know we've got a lot of members who've been really patient about presenting their amendments. So I'll just ask you this last question. Is I struggled to get some of your colleagues to provide what I would deem to be an intellectually honest answer, just again in terms of the impact of this bill on the deficit. So the Committee for Responsible Federal Budget, they put out a press release yesterday, or I guess it's May 20th. I don't know if that's today or yesterday. It's blended through multiple days. The title is House Bill Would Put 3% Deficit Far Out of Reach. And I'll just read from it. It simply says, Treasury Secretary Scott Bessent has frequently discussed the importance of reducing annual deficits to 3% of GDP, which would be enough to stabilize and reduce the debt relative to the economy. Unfortunately, the House Reconciliation Bill, the One Big Beautiful Bill Act, would increase deficits significantly and put the 3% deficit target further out of reach. You don't disagree with that?
Oh, no, the math is, look, this year.
No, I'm just asking if you agree with that.
Let's get this in. This year, we're going to borrow 7.33.
Sure.
Every tax hike proposed by the left is 1.5% of GDP. All the austerity is 1% of GDP. The fact of the matter is, we're not telling the truth. None of us are here telling the truth. That all the tax hikes and all the spending cuts, I get 2.5, we're borrowing 7.3. Moody's says, and now a couple others, in 9 budget years, we're borrowing 9% of GDP. Now, we can't tell our voters that because they'll lose their minds if we tell them the truth, that interest and demographics are the driver of debt. So unless we do the revolution...
Is the Committee for Responsible Federal Budget right? I guess I don't... what I just read is wrong.
But in some ways, that's the same numbers that just came out from CBO.
This bill would increase the deficit significantly, right? You concede that.
This bill will increase the debt by about 2.3.
Okay.
I would add another 400, and I can do the math off the top of my head because, that's my parlor trick. I would add another 400 in interest. I just gave you $2 trillion in savings. Please vote for it.
I hope the chairwoman gives you a chance to consider it. I'll yield back.
Ms. Leisure-Fernandez.
Thank you very much. And thank you, Mr. Stryker, for suggesting a lot of amendments that we know are not going to go into this bill, right? So in the end, there can be a lot of proposals and suggestions, but in the end, our job is to vote. And you have acknowledged that this bill will increase the deficit. And so the question then that the ranking member asked you is, you stand up week after week, and I've sat as the presiding speaker, that's how I first got to know this man with the grass, and said this is the wrong thing to do. But what will your vote be if you are so against increasing deficits? Will you be as principled as Tom Massey, who says, I am not going to vote for this bill because it will increase deficit? It's a yes or no answer. Are you going to vote for this bill? Are you going to vote for this bill with deficits?
It's actually not a yes or no answer because your baseline, let's do intellectually capital for just a second. Baseline borrowing is 22 trillion over the next 10. Okay, this is adding 2 1/3. But if you don't do a series of things to actually start to promote growth and the technology savings, I'm sorry, the differential between being an 8.8 in 10 years, percent of GDP to debt. That's our baseline.
The question
to going
is,
to 9.
Mr. Schreiber,
so,
we are not in the special order hour.
So let's actually.
Mr. Schreiber, we are not in the special order hour. We are here to ask you this.
Y'all are talking fast.
So if you're going to allow me as a member to respond, I'll give you a simple answer. Leadership doesn't have my vote yet. I have whipped no at this point. Would they come to me and say, David, this is too big to go in this bill, but I will guarantee you an opportunity to get a fair hearing on it? I gotta run. You gotta run with that because you gotta run with that because the fact of the matter is your side does the same thing, and there's very few of us who are willing to take both the political risk and the mathematical risk to do it. So are you going to come to me and say, look, you're a conservative, I'm a leftist, I'm going to stand with you if you get a chance, okay, libertarian, whatever you want to be called, an opportunity to have a fair hearing, both from the Democrats and the Republicans, on things that I believe disrupt the cost curve in the future. This is only one of a handful of things I've tried to bring. I've never been able to get a vote on them. Could I get a guarantee of the vote in the future?
So,
you might be able to buy my vote in this bill if I.
Well, our side doesn't buy votes. We don't accept.
Really?
We do not accept.
Really?
Do you want to see 400 million?
Do you want to see the amendments you all did
during
the Inflation Reduction Act?
I have not asked you a question.
Ma'am, I would almost like to take her words down for a bold lie.
It is. I'm reclaiming my time. It is a simple question, and we did not get a simple answer. And that's the thing. Is this? I have not asked a question. This is the issue. The question was whether or not somebody would take the political courage to vote no when there is a deficit, and that is what they stand for. And I need to acknowledge the gentleman from Kentucky, because the gentleman from Kentucky, your colleague of Tom Massey, and so I know you have conversations. I often have conversations with Mr. Massey, and he really is. This is a line for him, and he's willing to have the courage of that conviction. And I want to thank you for bringing up the story of June. And I want to thank everybody on this panel for bringing the stories of what does it look like in Ohio, the idea that if there is not work, how do you punish people? And we are likely headed into a recession. We've had the first quarter of negative growth. And it is absolutely true that our job is to create the opportunities and the possibility for people to realize their potential and to not starve them while they are trying to get an education or take care of their children, and to not penalize them depending on where they live and what state they live. And to focus on the stories that all of you have brought to us today. And while there might not have been very many Republicans on the dais, you looked at the Democrats, well, we have to go out to get a little break because we've been here since 1 o'clock in the morning. I can tell you that the American people are listening. And so this panel, like the panel before it, the panel before that, the panel before that, and the many more, they're going to come because I'm looking at this audience. And these are representatives who know that their job isn't about charts. Their job is about bringing to the American people the stories of how this bill is going to hurt their constituents. And then you know what they're all going to do? Is they're going to have the courage to vote their conscience whenever this bill makes it out of this committee. And so thank you very much. And Madam Chair, I want to tell you that I did say I would learn how to say devuelvo la palabra in Spanish. So muchísimas gracias for the time, and I am yielding back. Devuelvo la palabra.
Thank you, Ms. Leslie Fernandez. There I believe no other questions for the panel, therefore you're excused. On the I'm going to announce the next panel, and what I'd like you all to do is to move down this way to leave the places in the middle so people can move. So, Miss Castor, Mr. Levin, Miss Sewell, Miss Titus, Miss Delbeni, Mr. Espaillat, Mr. Amo, and Miss Susie Lee from Nevada. So, come on down. Amo, sorry. Oh, yeah. Here. I know some, but I don't know. I know most of these. So I'm going to call on you in the order in which I called your name to come up to the table. So, Ms. Castor, you're recognized for 5 minutes.
Well, thank you, Madam Chair. Thank you to the Rules Committee and your professional staff for the opportunity to give voice to my neighbors back home across the Tampa Bay area. If you ask my neighbors right now what they care about, it's affordability. It's the affordability squeeze. Many of them are rebuilding their lives, their homes after the devastation of Hurricanes Helene and Milton. They're trying to figure out what the highest import taxes and tariffs in 100 years mean on their rebuilding efforts. And now they're confronted with this billionaire boondoggle that is going to impact the affordability of their health coverage, their electric bills. It's really harsh news to them to hear that the Republican budget bill is going to rip away coverage to 13.7 million Americans. And that it's going to increase electric bills. It's going to restrict nutritional assistance, food, healthy food for kids and older neighbors in order to provide a major tax cut to billionaires who simply do not need it. And then on top of all of that, this last discussion was very illuminating. Let's not forget, this will add about $3 trillion to the debt. So that's going to weigh down their purchasing ability. It's going to weigh down their lives. Everyone who has kids, you're looking at this huge weight around their necks going forward. And this bill is one that's going to hit Floridians particularly hard because we have the most neighbors who use the Affordable Care Act for affordable health care coverage. So when you rip away that little bit of help to pay for their co-payments and their premiums under this bill, that means that they could lose coverage or they're going to be paying a whole lot more. For the 3.9 million Floridians who rely on Medicaid, which is really a lot of children, it's the people we love the most, our parents and grandparents in long-term care. It's 40% of every birth in the state of Florida. They just look at this and they say, what a contrast to what Democrats focus on. We focus on making sure people have affordable health care coverage. That's what the Affordable Care Act was all about. Outlawing discrimination against pre-existing conditions, allowing young people to stay on their parents' plan to age 26, lowering the cost of prescription drugs, restraining the cost growth in healthcare. That's why it's been so difficult to listen, and we've done some myth busting here. It's been difficult to listen to, okay, no one's going to lose health coverage under the billionaire tax giveaway, but we know what the CBO has said. And that's why I'm offering a couple of amendments. One with Representative Gray that says none of the provisions of this bill will have the effect of increasing the number of uninsured individuals. And then another that's focused truly on Medicaid fraud. If you all haven't followed this story out of Florida on Medicaid fraud, I encourage you to do so. And we can do that by passing my amendment here. There was a settlement for overpayment, overbilling of drugs by Florida's largest Medicaid provider. They entered into a settlement agreement, but the governor took $10 million out of the $67 million settlement and funneled it to political action committees to oppose constitutional amendments on the ballot last year that were totally unrelated. It was actually on cannabis. So he took the Medicaid dollars, funneled it through nonprofits, and then to political campaigns. So this has been a bipartisan investigation in the Florida legislature. And while there's been so much discussion here that there's so much fraud and waste and abuse in Medicaid, it's time to really go after some of the fraudsters in Medicaid. And I think this can be a bipartisan effort to tackle them, but back to the affordability. And the fact is, what I'm hearing from folks, it's not just from neighbors, it's from all of our hardworking providers. Most doctors groups are opposed to the billionaire tax giveaway, nurses organizations, and I wanted to read just a few for the record that have come to my attention. This is a letter from leading health advocates. Okay, I'm gonna offer this for the record and maybe hope that a few of my colleagues will ask about these when we get to Q&A. But this isn't right. Let's put the people's interest first over the special interest. Thank you. I yield back.
Without objection, they'll be put into the record.
Grandma.
Mr. Levin.
Madam Chair, thank you. My colleagues have made many powerful arguments against this bill today, and I'm here for a very simple reason. That's to offer what I believe is a reasonable bipartisan amendment focused on a shared goal, protecting the American people from higher energy costs. This amendment would ensure that key provisions in this bill, particularly those that eliminate support for clean energy and roll back environmental protections, cannot take effect unless the Energy Information Administration confirms that they will not increase monthly household utility bills. That's it. If the policies in this bill are truly going to reduce costs, then this amendment simply adds a common sense verification step to confirm it, nothing more. But independent analysis already indicates this bill would raise energy costs for American families by at least 7%. That's an average of more than $110 per year per household at a time when nearly 80 million Americans are struggling to pay their utility bills. We shouldn't be adding to that burden. Now, some of my colleagues have asked, look, if clean energy is so affordable, why does it still need tax credits? It's a good question. And the answer is this. Clean energy is already the cheapest source of power in many markets, but the transition still requires upfront investment. We need to build transmission lines, upgrade the grid, and scale American manufacturing. The credits help unlock those investments and deliver long-term savings to consumers. At the same time, fossil fuels continue to benefit from long-standing subsidies and infrastructure that's been built and paid for over decades. Without tax credits, we're not creating a level playing field. We're favoring the status quo at the expense of innovation and competition. These investments are not only saving families money in the long run, they're creating jobs, and not just in any one part of the country. The clean energy economy is growing in red districts and blue districts alike. Solar plants, battery storage facilities, wind farms, electric vehicle factories, grid modernization projects. These are putting people to work in rural areas, in small towns, in manufacturing hubs, and communities that have seen jobs vanish in past decades. From Georgia to Michigan, North Carolina to California, clean energy is rebuilding America's industrial base and restoring pride and prosperity, including in places that have been overlooked for far too long. If we eliminate the tools that are making this growth possible, we don't just risk raising prices, we risk losing momentum on job creation, competitiveness, and true energy independence. This bill also contains provisions that raise fees on renewables will make it easier and cheaper for fossil fuel developers to access public lands.
It weakens permitting protections, and it undercuts the economic foundation for one of the fastest growing sectors in our economy, all while shifting costs back to American families. Regardless of how you feel about clean energy or climate change, I hope we can agree on this. If we're going to pass legislation that affects energy markets, we have a responsibility to ensure it doesn't drive up costs for the people we represent. That's what this amendment does. It doesn't block the bill. It doesn't impose ideology. It simply says, let's get the facts first. Let's verify the real-world impact before we make irreversible changes. Our constituents expect us to be responsible stewards, not just of the environment, but of their hard-earned money. Let's show that we can work together to protect them from higher utility bills and preserve the job growth we're finally seeing across this country. I urge my colleagues to support this amendment and to stand up for families, for fairness, and for the future.
Thank you, Mr. Levin. Ms. Sewell, you're recognized for 5 minutes.
Thank you. Thank you, Madam Chairman, Madam Chair, for the opportunity for me to give a voice to the great people of Alabama's 7th Congressional District on this debate. I have 2 amendments. My first amendment, amendment number 209, would extend the Affordable Care Act's premium tax credits to Americans in non-Medicaid expansion states like Alabama, who are caught in this coverage gap, as well as Americans who have lost Medicaid coverage as a result of the Republicans' cut in this bill. 1.5 million Americans are in the Medicaid coverage gap. These are the working poor. They work every day, many minimum wage jobs, and they make too much money to be on Medicaid, but they don't make enough money to be able to afford health insurance. They are truly the working poor. We must not let the ACA enhanced premium tax credits expire December 31st, 2025. And we must expand the premium tax credit for low-income citizens below 138% of the poverty line. I have heard from countless constituents who fall in this Medicaid coverage gap and are desperate to get health care. I spoke recently with one of my constituents, Kiana, who is caught in this gap. She lost her health care, her Medicaid coverage, following the end of the COVID public policy emergency exemption. When she tried to qualify for Medicaid again, she was told that she made more than the $295 a month that would make her qualify. This was no help to her, and you know what? The big billionaire boondoggle bill won't be of any help to her either. In my state, Medicaid is a bare bone minimum program. You have to be really, really poor. Back home in Alabama, we call it being po. You can't afford the O or the R in order to get Medicaid in my state. So instead of giving handouts to the billionaires, I would say let us use this opportunity to increase the number of Americans who have health care coverage. This amendment would jumpstart coverage for people who have been left out for far too long. These are parents, they are people with disabilities, individuals who work but can't afford and don't have jobs that have health care benefits. Simply put, as 10 states seem committed to denying benefits for Medicaid expansion, I want my residents in the state of Alabama who fall in this Medicaid gap to get coverage. So I'd ask you to consider that amendment. My second amendment is amendment number 139. It strikes the $5 billion worth of private school voucher schemes that are in this bill. Under the Republican plan, donors who contribute money or stock to these voucher plans will receive a tax credit of 100% contribution back in the form of a discount on their tax bill. It really is outrageous that we would actually help the wealthy and well-off pay for private schools for their own children. There's nothing in this bill that stops them from making their own children eligible to receive this private voucher. I know this issue way too well. My home state of Alabama has adopted a dollar-for-dollar tax shelter for donations to voucher schemes, and Alabama's public school children and teachers are paying the price. The private school voucher scheme is modeled after states like Alabama. Many Southern private schools were established during and after integration. Today, these same schools are benefiting from taxpayer dollars flowing rapidly expanding voucher programs that are rampant with waste, fraud, and abuse. Instead of tackling the fraud in these programs, Republicans are hell-bent in overdrive, giving tax shelters in the form of a federal level. There's nothing in this bill that stops Alabama's wealthiest from being able to take a tax credit on the state level and now on the federal level. These academies do not have to live by the same standards as public schools. You know, in the state of Alabama, school choice doesn't really mean a choice. When you live in small rural communities that only have two schools, one that is public and all black, and one that is private and all white. That's in 2025, not in 1965. We should not be promulgating these opportunities. Public schools don't have the same benefits. And I know that my colleagues will probably ask me about these private schools in the state of Alabama, and I look forward to that robust discussion. But I ask Madam Chair for unanimous consent to put into the record these articles about segregated academies across the South that are getting millions in taxpayer dollars.
Without objection, Ms.
Thank you so much, and I ask for support of both of these amendments.
Thank you. Ms. Titus, you're recognized for 5 minutes.
Thank you, Madam Chairman and members of the committee. I agree with many of the things that have been said so eloquently before me about the cuts to SNAP and Medicaid. And I have several amendments offered. They range from helicopter roundups of horses to saving the National Endowment for the Humanities. But I'm here now to advocate for an amendment that would strike a provision in the reconciliation bill that allows for the sale of at least 65,000 acres in Clark County, Nevada. Now, my amendment doesn't impact northern Nevada, nor does it impact Utah, where the representatives there agree with those sales. I'm talking about my district in Clark County, Nevada. About 2 weeks ago, during the 11th hour of the House Natural Resources Committee meeting, Representative Amadei introduced an amendment to sell off public lands in southern Nevada. Again, this is an area that he does not represent. He snuck this provision in during the middle of the night without consulting with me, any members of the Nevada delegation, or the Clark County Commission. If he had, he would have known there was not support for this, and this was not a responsible way to accommodate growth or manage our natural resources. So I'm here to defend the public lands in my district and stop them from just being auctioned off by the GOP and have the money used from the auction to pay down the tax breaks for the wealthy. Decisions to sell public land should not be made on a whim. They deserve careful consideration with input from the public and collaboration with the stakeholders who will be impacted by the sales. I know this because I've worked on this issue for decades as a member of Congress and as a state legislator. In fact, I had a bill that came to be known as Ring Around the Valley when I was in the state legislature that looked at growth boundaries. It encouraged high-density development, rewarded infill over sprawl, and required developers to contribute to the cost of infrastructure. Well, that didn't become law. It was kind of called Ring Around the Neck or Ring Around the Collar by some of the opponents, and a picture of me with a noose on the cover of a magazine. But nonetheless, it started the conversation, and some of those things over time have been adopted. Representative Amadei's amendment was an irresponsible departure from that and will just roll back our attempts to kind of balance smart growth with conservation. Its proposal includes no offsets for land conservation, and in fact it appears that it overlaps a Viquame, a national monument that we just got created. Nor is it a silver bullet for addressing housing needs in Nevada. It does nothing to address the other factors that contribute to housing problems besides land costs. This includes supply chain issues, the Trump tariffs, a shrinking construction workforce, and lack of tax incentives to build affordable housing. What's more, it does nothing to address the infrastructure that will need to be built to accommodate far-flung developments caused by sprawl. and it ignores the drain on our very valuable resource of water because there are no built-in guide rails or guardrails. In fact, just this month, a report from the USDA's Natural Resources Conservation Service showed just how serious our lack of water is, both in Lake Powell and Lake Mead is at 33% capacity, down 920,000 acre feet, which equates to enough water to service 1.8 million homes. Furthermore, the U.S. Drought Monitor shows that areas in Clark County slated for land sales in this amendment to the reconciliation bill are in conditions that range from severe to exceptional drought, that being the most extreme. Nor does it take into account the new guidelines, the soon-to-be determined post-2026 operating guidelines for the Colorado River, and that has potential to shape our water allocation. If we're going to develop more land, we certainly need to take in that reality. Finally, nearly $1 billion in estimated revenue from the sale of this land in southern Nevada would go directly under this amendment to the U.S. Treasury, not come back to the state to be used for outdoor recreation, preserving critical ecosystems, or wildfire protection. So the public lands of Nevada will not be sold to benefit southern Nevada, nor will they be put up for sale by someone who represents southern Nevada. So for all these reasons, I would ask you to take this into consideration and let the people of southern Nevada have a say in what happens to their public treasures. I yield back.
Thank you, Ms. Titus. Ms. Del Bene, you're recognized.
Thank you, Madam Chair and Ranking Member McGovern. I'm offering an amendment that is a proven solution to grow the middle class and significantly slash childhood poverty. Families across the country are struggling to make ends meet, and addressing the high cost of living is the #1 concern for Americans. My amendment would restore the largest ever middle-class tax cut by increasing the child tax credit and making it fully refundable. The current child tax credit leaves out 1 in 3 kids because they live in families that don't make enough money to access the full benefit. The Republican bill will leave out 17 million American children who are in families that don't earn enough to receive the full child tax credit. This Republican billionaire bailout bill would give the ultra-wealthy millions of dollars in tax breaks, while a 2-parent family working full-time, earning minimum wage, wouldn't qualify for the full child tax credit. Republicans claim to be pro-family, but they are knowingly leaving out the parents and children, the families that are struggling the most to make ends meet. I recently met a mom from Washington who has 4 adoptive kids. One of her children has a severe developmental disability and requires constant care. She worked multiple jobs so she could provide for her children. In 2021, she began receiving monthly child tax credit checks under the Democrats' American Rescue Plan. These payments allowed her to bring in extra help to care for her special needs child, so she could also spend more time with her other children and do things like taking them sledding in the winter. She told me that she finally felt like she had room to breathe with the extra money that helped support her family. That's what families really want, the stability and certainty that they can not only just get by, but also get ahead. Since the child tax credit payments ended in 2021, she's had to pick up more work to make ends meet again, meaning she spends less time with her kids. This budget bill shows where people really stand and shows where Republicans really stand, and it's not with hardworking Americans. If they did, they'd be giving tax cuts to the middle class, not the wealthy and the well-connected. They'd be expanding programs like the child tax credit so that parents who are working full-time but still struggling to make ends meet can get the full benefit. I urge my colleagues to support that amendment. I also have a second amendment that will reassert Congress's authority over trade, which is based on my legislation, the Prevent Tariff Abuse Act. President Trump has been waging a trade war around the world since he took office. This includes our close allies and economic partners like Canada, Mexico, and the European Union. These tariffs are increasing costs for small businesses and raising the price of goods that families rely on every day, like groceries and household products.
The president has callously said he could care less if prices go up because of his tariffs. Trump is openly telling Americans that they'll have to live with less and pay more under his economy, and for no reason. It's abundantly clear that there's not a plan or ultimate goal for what he wants to accomplish with these tariffs. He imposes tariffs one day, then removes or delays them the next, and this chaos is damaging to our economy and making America a difficult place to do business. If someone comes to the White House or Mar-a-Lago to bend the knee, maybe they'll get a special deal, and that reeks of corruption. The justification the president used to enact these tariffs was the International Emergency Economic Powers Act, or IEPA. For example, Trump imposed tariffs on Canada under the guise of a national emergency over fentanyl. But in reality, significantly, orders of magnitude more fentanyl goes into Canada from the United States than comes the other way around. Sweeping tariffs should not be put in place at the whim of a president. There should be a vote in Congress. We used to have bipartisan support that we needed to assert our congressional constitutional authority over trade. And we had that bipartisan support when President Biden was in office. But suddenly, Republicans are silent. If a Democrat was in the White House today, would you let them raise taxes on your constituents by thousands of dollars a year without a vote in Congress? I offer this amendment to give everyone the opportunity to make it clear that any president must come to Congress for a vote before he can put in place sweeping tariffs. We are a co-equal branch of government, and it's our job to stand up for our communities, not blindly follow the executive branch. I urge my colleagues to support this amendment as well, and thank you, Madam Chair. I yield back.
Thank you, Ms. Delbene. Mr. Espaillat.
Thank you, Madam Chair, Ranking Member. Madam Chair, this debate about Medicaid cuts is really a debate about life and death. The Medicaid program is not a Democratic program. It is not a Republican program. It is an important program for constituents in red districts and blue districts. And I have 488,000 people in my district that are Medicaid recipients. And I'm sure that many members across the aisle, perhaps including yourself, have many constituents that rely on the Medicaid program. So this is ultimately a debate about life and death. And I feel that this bill does not live up to the promises that the majority has made to the American people. For months and weeks, we've heard how Medicaid would not be touched. Americans were told that this bill would also reduce the deficit and restore the middle class. Instead, the bill will allow for millions in tax cuts to the very wealthy and increase by $2.3 trillion the national debt. Americans were told that the Medicaid program was safe and cuts are occurring. Instead, we see provisions that would cause nearly 14 million Americans to lose their health care, and millions more will have to pay higher premiums and co-pays. Adding ineffective work requirements and lowering the federal matching rate for Medicaid in states are just some of the provisions that will result in millions of Americans losing their health coverage. Again, this is a debate about life and death. The loss of coverage would have a rippling effect on healthcare. Federally qualified health centers and safety net hospitals rely heavily on Medicaid reimbursement to provide high quality care. In my home district, New York's 13th district, 72 federally funded health centers rely on federal investment to serve close to 1 million patients. Clinics like the Borique Health Center in Harlem, the Morris Heights Medical Center in the Bronx, and the Ryan Health Center in Washington Heights in Manhattan are essential to the medical ecosystem of that district. These clinics are much more than just health centers. They provide primary care. They provide preventive health care to kids with asthma, adults with diabetes. They host food pantries. The ranking member was in my district to see one of those at a school because they understand that food is medicine. Because this is a debate ultimately about life and death. This is not a comfortable debate. This is not an easy one. This is not one that we can laugh about. This is about life or death. Without a strong Medicaid program, these health facilities will be forced to limit their services that they offer. They lay off staff and they will even have to close. That is why I've introduced Amendment 309, which will require the Health and Human Services Secretary to conduct a study and report to Congress the effects of Medicaid cuts and the reduction in services of federally qualified health centers like the ones I described, community health centers, and safety net hospitals. These safety net hospitals are the last resort for working families that are sick, that cannot provide or have the money to pay for a Cadillac health plan, a private health plan that is so expensive. That's why I have 488,000 patients. Cuts to Medicaid will increase the uninsured rates and will dismantle healthcare. We must protect safety net programs. I urge the adoption of this amendment. And I yield back.
Thank you, Mr. Espaillat. Mr. Amo, you're recognized for 5 minutes.
Thank you, Madam Chair. Thank you, Ranking Member, and thank you to the members of the Rules Committee who have been here from darkness to light, and hopefully not to darkness again. But I've got to be clear that the moral darkness of this plan remains. There is a clear contrast in values here. And budgets are, as we know, are a statement of values, and my Republican colleagues have been showing through their force the stature of their values, and I don't find them to be high in this moment. As Americans slept and as they awoke, they are experiencing a reality where there's a strategy, an attempt, a plan to take away healthcare from more than 3.7 million Americans, school meals for 18.3 million children, food assistance for about 11 million hungry people, and access to higher education for 4 million aspirants. In my home state of Rhode Island alone, 28,000 people would lose health coverage by 2034. Over 12,000 students would lose some or all of their Pell Grant funding. And 21,000 Rhode Islanders would lose some or all of their food assistance. These are people's lives. This is their health. This is their future. And I'll say it again, that budgets are a statement of values. And this tells tens of thousands, hundreds of thousands of Rhode Islanders that they don't matter. And that is not true. These cuts are made all the more egregious by the fact that they are being used to finance a tax scheme that gives out handouts to the richest Americans. As written, this disastrous reconciliation bill would give the richest Americans an extra $82,000 just to begin, going up for more and more and more, yachts and fancy cars and trips to exotic places, while people on the other end suffer. It meanwhile would also hike the lowest earning Americans tax rate by 19%. It's a moral inversion, a reverse Robin Hood scheme to steal from the poor and give to the rich. We saw the numbers from CBO, seeing household resources for the bottom 10% go down by 4%. For the top 10%, go up by 2%. And those might seem like small numbers, but the scale of the increase for the top is just immoral. And that's why I introduced Amendment 355, which would raise the top tax rate back to 39.6%. And conveniently, this is something that President Trump said himself, right? Broken clock is right twice a day. And I think we know that we have a revenue problem. We know that this is something we will have to deal with. And we know the wealthy not only can, but they should pay more. We just have to have courage. And I encourage support for this amendment from my colleagues on both sides of the aisle. And this amendment, of course, won't solve everything. We know that this Republican bill still strips healthcare from over 13 million Americans and puts 1 in 4 SNAP recipients at risk of losing benefits. It remains a betrayal. Raise the rate. It still doesn't solve for that, but it makes it slightly less fiscally irresponsible. Moody's cited our revenue challenges, specifically in their downgrade. Now, on to another amendment, because the devil's really in the details here. And beauty is truly in the eye of the beholder when it comes to this legislation. And I had to pay real close attention to this one to see how ugly this portion is. And it's why I'm proud to co-lead Congressman Mike Johnson's Amendment 374, which would repeal the provision that eliminates the $200 tax on silencers. Silencers make mass shootings worse, more deadly. They make it harder for victims and law enforcement to locate the source of the shooting. What is beautiful about that? Making them cheaper. Not only does this provision make silencers more accessible, it would cost $1.4 billion. Here we are stealing, seeing a theft from Republicans of healthcare so that we can eliminate silencers? It's illogical, and I can think of better uses for $1.4 billion. Let's focus on caring for the sick and feeding the hungry and not making silencers cheaper. It's not fiscally responsible that you would do all of this while adding trillions to the national debt. And because of policies like these, we will face challenges. So with that, I encourage support for these two amendments, and let's get our house in order and focus on the people who need our support. Thank you. I yield back.
Thank you. Ms. Lee, you're recognized for 5 minutes.
Thank you, Madam Speaker. I'm here to ask for support to my amendment to this big bad billionaire bill, or whatever it's called. It's not about the nearly 100,000 Nevadans who will be left without health care. It's not about the thousands of homebound seniors who will no longer receive Meals on Wheels. It's not about the trillions that will be added to our national deficit. It's about water, something so precious and important to my home district of Southern Nevada. My amendment aims to stop Congressman Mark Amodei and the House Republicans from moving forward with the Trojan horse Utah land grab that jeopardizes Nevada's water security and could very well derail sensitive and complicated negotiations about the future of the Colorado River. I'm here because 2 weeks ago, literally in the middle of the night, seems to be a recurring theme for how Republicans legislate, Rep. Amodei advanced legislation in the Natural Resources Committee to sell off hundreds of thousands of acres of federal land in Nevada and Utah. The proceeds from those sales would go to Washington to pay for billionaire tax breaks in the budget bill. Mr. Amodei claims that this sell-off is necessary to lower the cost of housing. I've always supported releasing more federal land for housing in Nevada. In fact, I've introduced and passed bipartisan legislation to do exactly that. But my first problem is that this proposal really isn't about housing. The Amodei proposal doesn't require that land sold in Nevada be used for housing. In fact, there is very little information on how exactly this land would be used, which leads me to my second issue with the proposal. For decades, the law has ensured that proceeds from federal land sales in Southern Nevada, which, as Congresswoman Titus has said, have been negotiated and supported by local government, but that those proceeds stay in Nevada. This proposal from Amodei would instead send these proceeds to the federal government, and Nevada would lose billions of dollars. This would mean less money to build more schools, water infrastructure, parks, and so much more. In fact, federal land sales in Southern Nevada have generated about $500 million to date to invest directly in Southern Nevada water priorities. Under Rep. Amodei's own projection, this move could divert nearly $8 billion over 10 years from Nevada. Think about it. Who would then pay for things like water and parks and schools? Nevada homeowners. So Amadei's move actually increases housing costs for Nevadans, not decreases them. And let me remind you that Rep. Amadei does not represent any part of Clark County, and his proposal is not supported by the county government or any member of Nevada's federal delegation elected by voters of Clark County. I would never introduce a bill to sell off land in another congressperson's district without consulting with them. Congresswoman Titus just proposed an amendment which I support, but I finally want to talk about the third issue with this proposal and the purpose of my amendment, which relates to Nevada and the Southwest water security. Arizona Congressman Greg Stanton and I have been alerted by water officials in Nevada and Arizona that the public land that Amadei wants to sell off in Utah could be used for a controversial water pipeline. The parcels of land marked for sale in this proposal, coincidentally, line up with the land in Utah that has been targeted for the so-called Lake Powell pipeline. This proposed pipeline has been greatly concerned water managers in Nevada, Arizona, California, Colorado, New Mexico, and Wyoming. These are 6 of the 7 states that depend on the Colorado River, every one except Utah. If this land is sold and the pipeline is built, this could divert 28 billion gallons of water each year from Lake Powell and the Colorado River to communities in southern Utah, away from Nevada, Arizona, and other basin states. Look, Amadei did not consult local authorities in southern Nevada, and it shows because he clearly doesn't understand the relationship between water and development and housing costs. I support the Titus Amendment. I'm asking you to advance my amendment to repeal the Amadei land sale in Utah so we can stop this Trojan horse to steal Nevada's water. Thank you.
Thank you. Mr. Langworthy, you have any questions? No. Mr. McGovern?
Ms. Sewell, I don't know, did you have anything else you wanted to add?
Thank you so much.
Yes.
Yes, you know, I was starting to talk about the effects of this horrible bill on public schools and the fact that these school vouchers are now being federalized. I mean, there are lots of states, including my own state, that gives tax credit to parents who put their money in a foundation. They call it a foundation. There are no requirements as to who's eligible. So what happens is that lots of parents who already have their kids in private school now will have an opportunity 1-for-1 to get those to get that a tax credit for that. And in my state of Alabama, a lot of those private schools popped up as a way of avoiding all deliberate speed in Brown versus Board of Education and created these segregated academies. And so I don't want this bill to give further credence to these vouchers being about choice when there are very little choices when you have small communities that are made up of 5,000 people and there's one public school and there's only one academy, and that academy is still all white in 2025. And, as a public school kid and parents who grew up, parents who were public school teachers, and my mom's a librarian and my dad was a high school basketball coach, I can tell you that in Selma, when I was growing up, the best school was Selma High School. It was Selma High School that sent kids off full scholarships to Duke and to other places. It wasn't the private academy that was private, but didn't have a full array of sports or debate team or any of that. And I don't want to, as a member of Congress, promote these vouchers, which are, and this bill gives $5 billion, set aside of $5 billion for these private school vouchers. So thank you so much for giving me the opportunity to talk about it. And I know that these private schools don't have to take the disabled or special ed kids. They have very different standards.
Yeah, so thank you for that. And to everybody on the panel, thank you for your amendment. Thank you for waiting around. Thank you for, again, your passion, your commitment to trying to make this bill better. I support them all, and I'm just so grateful that you are here. I yield back.
Thank you. Ms. Sewell, you just said something, though, that I have to correct, because in this bill with the vouchers, if a student does have an IEP, that has to be honored if the student goes into a school with a scholarship. So you are mistaken, I have to say, for the schools. That is a part of that piece of legislation. So they do have to take students who have IEPs. If they're in the public schools and they have IEPs and they transfer.
Well, I can just tell you that in Alabama State, because they're going to vote, and I understand what you're saying, but clearly, because schools are mostly controlled by states.
But in this legislation, there is a provision on that. It may not be true in Alabama, but it is true in this legislation. Okay. Thank you, Ms. Scanlon. You're recognized.
Thank you. I would just add, however, that the way that would be enforced would be through the Department of Education's Office of Civil Rights, which has just been gutted by the Trump administration. So
That's a very good point.
Thank you. I did that work for a long time. Mr. Levin, I think you mentioned that the bill would raise energy costs for families. Is that right? Can you give me that figure?
Yep, by 7%, about $110 a year.
Okay, so if the energy costs for the family are going to go up by $107 per year and their tax break is going to be $265 per year, we've already eliminated half of that. And then if they're going to have problems with their health care costs because we've cut Medicaid and we're eliminating the ACA credits, you begin to see how the budget office has determined that the prices for average families are going to go up.
Well, this is a lousy deal. So if you're making, the statistics I saw is if you're making under $51,000 a year, you're going to wind up with $700 in increase taxes, tax burden per year. And if you make over $4.3 million, your taxes are going to go down by an average of $389,000. So the rich get richer, and that's what these folks want to do.
Okay. And Ms. Castor, you were talking, one of your amendments deals with having HHS investigate the potential for Medicaid fraud. Isn't that something that inspectors general would do for HHS under ordinary times when we had an inspector general?
That's correct. And in fact, just today, the Senate Homeland Security and Government Affairs Committee issued a major report on the impact of Trump's firing of all of the inspectors general, the folks who, these are the cops on the beat that root out waste, fraud, and abuse. You're right, if we don't have the cops on the beat, if we don't fund them through our appropriations, that's money lost to the taxpayer.
Right, and in the past, I think the Inspector General has found Medicaid fraud in Florida to the tune of $1.something billion with the Columbia Hospital System.
That is correct. Unfortunately, Florida is a magnet for a lot of the fraudsters. We have a lot of older neighbors, a lot of retirees that are often subjected to this. But I mean, it knows no bounds. So why don't we instead of creating this false narrative that there's a hardworking person with a child with a complex condition trying to rip off Medicaid, it's often these large-scale schemes by different insurance providers or managed care providers, and that's where the focus should be.
Well, and that was the presumption that I wanted to push back against, this idea that you have individuals who are out there committing fraud against Medicaid when in fact the big dollars that do from time to time get wasted, get defrauded, tend to be from large-scale providers, and that's the kind of thing that we do need these inspectors to root out. Thank you all for being here. Thank you for everyone who's still waiting in the wings. We'll continue the rules rave as we head into our 16th hour. So thank you. I yield back.
Thank you, Ms. Scanlon. Mr. Nagush, you're recognized.
Thank you, Madam Chair. Thank you to our colleagues for your testimony, for your patience, for being here on behalf of your constituencies. I want to talk a bit with my colleagues from the West, with Ms. Titus and Ms. Lee, about what I think to be one of the most insidious provisions of this bill, which was this midnight public lands sale. And both of you articulated well what makes this provision so problematic, so repugnant, something that I actually thought Republican leadership would have already removed. Perhaps we'll see that in the manager's amendment. Time will tell. But I think insofar as neither of your amendments are accepted in order and this language isn't removed from the bill. I think it would be violative of a core norm that has governed land conveyances and the consideration of land conveyances by this body for a long time. So just to kind of unpack that, as you know, I serve as the ranking member on the Federal Land Subcommittee. One of the most bipartisan subcommittees in the Congress. It was the most productive subcommittee in the last Congress. We marked up more bills than any other subcommittee in the House. The vast majority of them are bipartisan, mostly on suspension, most regarding land conveyances. Those typically are done through regular order, a legislative hearing. Were these land sales considered as a part of a legislative hearing? Ms. Lee?
No, they were not. In fact, the amendment was literally unusually dropped right before it was heard, rather than at the beginning of the markup hearing.
That's precisely right. Ms. Titus, were they considered in a markup prior to being included in this bill?
No, they weren't, and furthermore, that we were not informed about them in advance. As you well know, any kind of public land decisions go through a long process. Stakeholders come, you have public hearings, local elected officials weigh in, BLM plays a role. None of that happened. This was just dropped all of a sudden, and to add insult to injury, it is in a district that Mr. Amadei does not represent. It's in my district. And it goes against all of the SNPLMA provisions that have been in place for years, where the money from land sales in Nevada returns to Nevada to be used to save Lake Tahoe, to do bicycle trails, energy conservation, firefighting, even some goes to education. None of that was considered.
Yeah, it as I said, violates every norm in the book. No legislative hearing, no legislative markup, introduced at the dead of night without any consultation with the colleagues who actually represent the areas in question. It's opposed by the local counties, opposed by the congressional representation, opposed by the U.S. senators who represent the state in question. And I just have to say to my colleagues, and it gives me I don't enjoy saying it, majorities come, majorities go. And my colleagues will have reaped what they sow insofar as this measure is included. And I made that case to Chairman Tiffany on the Public Land Subcommittee, just to give you a sense of what this looks like so that we just kind of understand what the future holds. I haven't had the privilege of visiting Mr. Langworthy's district. I hope one day, maybe I'll get an invitation, but just so he's aware, I would hope that he makes the case to Mr. Tonko and Mr. Morelli and the neighboring districts that are adjacent to his, let's say Chautauqua County, for example, because if Mr. Morelli comes to the Public Land Subcommittee, if we're in the majority 18 months from now, and says, you know what, I'd like to pursue a wilderness designation in Chautauqua County. I don't represent Chautauqua County. Nicholas Langworthy represents Chautauqua County, but I know the county is against this measure, but that's okay. I think we should proceed. There'll be no legislative hearing. There'll be no legislative markup. There'll be no consideration of how your constituents feel. If we applied the principle that you're applying today, that land measure would be on the floor for full consideration by the body without a moment's care for your position on it. And so I am again in awe that we haven't been able to convince my colleagues that this is not a precedent that they want to establish. I suppose we'll see what happens on the floor. Last point I'll make, Ms. Lee pointed this out. I was unaware when this was introduced about the water diversion project. I mean, this is part of the reason I suspect why they introduced it in the dead of night in the land sale, because it would be disastrous for the state of Arizona. And I don't know how any of my colleagues from Arizona on the Republican or Democratic side are going to justify a vote against protecting their water sources. It makes no sense to me how they're going to rationalize that. Had this been vetted in a legislative hearing, we would have had an opportunity to hear from the Bureau of Reclamation and the various water authorities and have the necessary sunlight to expose this. We were deprived of that opportunity. And now you have 6 basin states, all including the state of Colorado, the headwaters of the Colorado River, as Ms. Lee knows, are in my district, opposing this effort. And I hope we'll hear, I certainly plan on spending some time on the floor on this issue, and I would welcome my colleagues from Arizona, my Republican colleagues, if Mr. Gosar is watching somewhere in the building. I would welcome him to the floor because I'd love to hear what his response would be. Ms. Lee?
And for that matter, any colleague from the West who has a large percentage of federally controlled land in their state, who traditionally this type of move would never be made, one, without any input from a representative from the district in which the land is, which is mine, and or any county official. So I know that Representative Zinke has led an effort to withdraw this amendment, and I hope that other Republicans join him.
Yeah, I couldn't say it better, and I appreciated Mr. Zinke's leadership, frankly, in pushing that forward. I support his effort, and we'll just have to see. But in the interim, if folks have ideas about, potential wilderness designations in Western Virginia, or perhaps parts of northern Minnesota, or Chautauqua County in New York, we're taking ideas, and we've got 17 months, I guess, to do that. So anyway, I will yield back the balance of my time.
Gentleman yields back. Now recognize Ms. Ledger Fernandez.
Thank you. I'm supposed to use this one. Thank you very much. And, I think that this testimony that we've heard today and all day long really talks about that there are a lot of transfers going on in this bill, right? Transfers from working families to the wealthy. Transfers, in your instance, I think you wanted to talk a little bit more about the idea that we're transferring resources from public schools. And what does that then mean for the children of those public schools? The transfer of wealth away from the children who need it most with the child tax credit to those who need it the least, right? It would be my guess that my kids are too old now, but I could make do without that child tax credit. But somebody who's making $15,000 could really use it. And Representative Del Bene, and I think this education piece to the both of you goes to what does it mean for a child to have the right kind of education, but also the child tax credit removes the stress that is in a household that has high poverty. And Republicans refuse to continue the expanded child tax credit they have. Could you just real quickly, maybe the two of you, just some quick thoughts on that impact on the children's education?
Well, we know when we had the expanded child tax credit in place, we cut childhood poverty across the country almost in half in just a year. Childhood poverty costs us $1 trillion a year in the United States. So not only is this important policy because it supports families, helps our kids get off to a great start, it also is fiscally responsible policy and actually saves us money. So the challenge that we face in this bill is that 17 million kids across the country are left out because their parents don't make enough money to have the tax burden to get the full credit. And what we did previously with the expanded child tax credit is we said we are going to make sure that the families who need the most, the lowest income families, they may not make enough to have a huge tax burden. We're going to make sure they get the full benefit. And what did people spend that money on? On housing, on food, on school supplies, making sure their kids were doing okay. It's an incredible investment, but those 17 million kids across our country are in the most need. They won't receive the full benefit in the way this bill is written. We can fix that. We've done it before.
And we need to trust families to make those decisions.
And we know it
what's
works.
Fascinating is that Republicans sort of, they want to say no regulations, but boy, do they regulate families. I don't know if you want to have, you said you wanted to add something more, so that's why I think I wanted to make sure we.
No, I just really wanted to, I think that this is a further, we're further degrading public education. I mean,
Education is a great equalizer. It gives people opportunities. It can level the playing field. And when you take away and siphon public dollars that should go to public schools and you're giving tax credit for private schools, I think we're sending the wrong message. And I can tell you that Head Start gives people a head start. And when you are taking money away from public education, you're decreasing the amount of chemistry labs we have, better libraries that we have, books and teachers for that matter. And I just think that it is a transfer of wealth and of dollars from one to another. And it's sort of like Robin Hood. You're taking from the least of these and giving it to the most of these.
Thank you. And of course we have let's tax the billionaires. That would be the right way to do the transfer. And thank you very much for bringing that amendment, right? Like if you don't want to benefit, and if you want to make sure that there isn't the transfer of wealth going the wrong way, that's what your amendment does. And I thank you very much for it. And then finally, there we are on, making sure that we are losing the battle for renewable energy. Thank you for championing those. And then finally, the respect that we should have for due process for our immigrant population and to say, let's stop demonizing our immigrants because they pick the food. Somebody was saying, well, it's the farmers who do the food, produce the food. You cannot, demonize the farmers earlier today. But actually, who's the one who's actually picking that food and, helping care for our elders, helping care for our children, all of that. And I think that what you all did today on this panel was bring all those many aspects of this bill to light. And so I'm very grateful that you did that. And once again, we have a room full of colleagues who are bringing some other great amendments to bear here. And so with that, I yield back.
Gently yields back, and that concludes this panel. Thank you all for being here. And we're going to look forward to the next panel stepping forward as we let those get out first before we have a big shift.
More to follow.
Starting on this end, so that we have everybody in order.
Yeah.
Ms. Lofgren, Ms. Houlihan, Ms. Underwood, Mr. Swazi, Ms. Rivas, Mr. Gold.